On the delivery suite here in Gloucester, we see lots of different people, but they roughly fall into three groups. So there are the delivery suite is the only place where you can have an epidural. So if you choose to have an epidural, or you get to the stage in your labour where you think that you would want to have an epidural, you'll be moved over to delivery suite where there are anaesthetists who can provide that for you. There are the other groups of people who are advised to deliver on delivery suite because we're worried about additional risk factors for them or for their baby. And there are lots of different people, but the only place that you can have continuous electronic fetal monitoring is also on the delivery suite. And then there are some people who, and these are not very many people, who start off their labour in a low risk unit and need to be moved to delivery suite because there are complications in their labour. So we do see a few of those.
I was advised to deliver on the delivery suite rather than the birth unit. And actually, I felt that was the safest place to be, having had that experience of an emergency cesarean section before. They've got a gorgeous room, pool room on delivery suite. Pool berths are available if that's what you want. But you can have a normal, low-risk delivery on delivery suite with all the same care that you could get on the birth unit.
There are some people who start their labour here and are here because they've planned to be here from maybe early in their pregnancy, or they've developed complications in their pregnancy which mean that we would like them to be on delivery suite and looked after here.
Pain relief wise, on delivery suite you have more options, and those options are not necessarily thrust upon you if you don't want them. If you're coping well and you want to use oils or gas and air, then that's fine. But the option's there to have an epidural if you want it, or to have more input from doctors if you feel you need it, and the security of knowing you're in the right place if anything goes wrong.
And the epidurals that we provide, the aim is that they're mobile epidurals. So most women who have an epidural actually have quite a lot of mobility in their legs, can move around the bed, can mobilise to the loo even with their epidural in. Most of the deliveries that happen on the delivery suite are actually normal vaginal deliveries. But the medical staff will be involved often in the care of the labour, the woman who is labouring. We have a monitor in the office which relays every baby's heartbeat trace to a group monitor, so we can see everybody's baby's heartbeat traces even when we're not actually in the room. Thinking about having your baby on delivery suite, there are lots of things that we try and do to make it a positive birth experience, even though there may be some more medical intervention. And the simple things like making sure that you have early skin to skin, dads or birth partners cutting the cord. We regularly use essential oils, and then we do have a pool on the delivery suite, and all of our continuous electronic fetal monitoring, which you may find that called a CTG, is wireless, so you can still have your baby monitored closely whilst you're on the ball or in the pool. You can be up and down in the room, you can mobilise to the loo.
When I delivered, I was on my knees facing the back of the bed, so I needed a little bit of help to turn around because it was all a bit slippery. And the girls, the midwives, just sort of tidied up the bed, tidied up the room. My husband helped me sit round and helped me to sort of get the baby onto the breast, and it was really, the girls just sort of melted away at that point. They were very busy doing bits and bobs, but for us, it was just like everything just sort of settled for us in a little bubble. And we had lovely time to just get to know her and have a good look at her, and you know, examine the little tiny fingers and whose feet does she have and that sort of thing, you know. And it was really lovely, and when they'd done all their tidying, off they went and came back with a tray of tea and toast. Yeah, it was a really lovely experience.
So the care on delivery suite is still mostly provided by the midwife. You may see a doctor from time to time in your labour. Sometimes we will do a ward round, introduce ourselves, explain any additional care that you're having, and As your labour progresses, we may need to come in more often, but there are certainly some women who have babies on delivery suite who will barely see a doctor at all, and that's fine. If your labour goes straightforwardly and you just have the closer monitoring, but it turns out that your baby is fine, copes well with labour, and you have a normal vaginal delivery, and that's great. If you do need some extra care, we're just around. So what you have on the delivery suite is very much midwife-led care, but you have a medical presence which is mostly outside of the room, available for you should you need it at any point. So after you've given birth, if you need to stay in hospital, then we would transfer you up to the maternity ward. It is possible for some women to have a 6-hour discharge from delivery suite, but the majority of women would spend a short period of time on the postnatal side of the maternity ward, which is just one floor up.